Hello again. I saw a patient recently who had a hip replacement a few years ago, not done by me. He went out for a bike ride when he was run into by a car. He landed on his side and his femur broke around the stem of the hip replacement. We call this a periprosthetic fracture, literally a fracture around the prosthesis. Here are the radiographs showing the splintered bone and the hip replacement. It's a bad injury that needs very careful assessment and treatment to get the best outcome. Because the fracture had caused his hip replacement to come loose, he had to have it removed and a bigger one put in its place. These implants are made of titanium. They fit into the bone canal, bypassing the fracture and getting a firm grip in the healthy bone further down the femur. The fracture was repaired around the new hip replacement using steel cables to hold the bone in place. Here's a radiograph of the repair. Within a few weeks the bone had healed and he was able to return to work. It will take him a year or two to recover fully, but considering it's such a bad injury, he's had a really good result. He was treated in a hospital where there is a highly skilled and experienced team who did an excellent job. Let's look in more detail about what happens if the bone breaks around your hip replacement. It's an increasingly common problem, not just here in the UK. Studies show that fractures occur in about 1 to 4% of hip replacements. We do about 120,000 hip replacements a year in the UK, so that's a lot of people at risk. The numbers are increasing because we're living longer. As we get older, our bones get weaker and we're more likely to fall and break something. Some fractures happen during surgery, but mostly they happen after an injury. Sometimes the hip replacement itself breaks because of metal fatigue. Here's an old Charnley hip replacement that I revised a long time ago. You can see where the metal has just given way and deformed. We don't see this very often nowadays. The treatment options for periprosthetic fractures include non-operative management, like using crutches for a few weeks until the bones heal, surgical fixation with plates and screws, and revision or redo surgery for loose implants, like the one in the patient I described. Surgical fixation is typically done when the implants haven't been loosened by the fracture. Revision surgery is more common in cases where the implants are loose or the bone quality is poor. What about the results of surgery? Recent studies have shown good results in terms of pain relief and restoration of mobility, but complications like infection, failure of the fracture to heal, and healing in a misaligned position were seen in up to 20 to 30% of patients. These complications increase the likelihood of needing further surgery, particularly in patients with weak bone or complex fracture patterns. What can you do to reduce the risk of a periprosthetic fracture? First of all, choose a busy surgeon who does lots of hip replacements. The more you do, the better you get generally. Make sure you're as fit and as healthy as you can be before you have surgery. Lose some weight, eat healthy food, stop smoking and cut back on the booze. Take vitamin D supplements. All of these things will help to improve your bone health. After surgery, follow the advice of your surgeon and physiotherapist. You need to work on improving your fitness, strength and balance to reduce the risk of falling. In the longer term, keep moving and stay as fit and as strong as you can. The good news is that most people have an excellent outcome after hip replacement surgery and will never have a periprosthetic fracture, so try not to think about it too much. If you'd like to know anything more about hip surgery, please get in touch. The details are in the description below. If you've got any questions or comments, please leave them below. Thanks for watching. See you all again next time.